So the patient here is presented with a painful lump over their the joint in their big toe. So looks just like a callus, but then as we remove some of this callusing, you can see there's actually some hardened sections in there. They're somewhere between corns and callus. They're not quite corns, not quite callus. They're just a little bit hardened sections. So what we're doing here is just removing the overlying skin. You're never really sure what you're actually going to see once you start into these things. Sometimes you get abscesses, sometimes you get tissue breakdown, sometimes you get corns, callus, warts. So you have to be a little bit careful just going through there. We're really just looking through these. Sometimes we use an alcohol wipe to see through the skin, but you can see that callus skin's really coming off there now, and you can see that hardened section there in that ridge. It will need to come out. So this is causing her quite a bit of pain when she's walking around. So they're just caused by pressure. So the pressure causes thick skin to develop, and the thick skin causes more pressure, and it keeps going around in that positive feedback loop where you get more and more hard skin until it becomes painful and unbearable. So generally what we're trying to do is obviously relieve the pressure from the area. Wide shoes, deep shoes, cushioned insoles, insoles that take some weight in the arch, not on the big toe. But if there's a toe deformity or there's a bony lump in the toe, it's really difficult to fix these. So generally what we say is you can get surgery on this, or most people opt just to get it regularly treated to relieve the pain. We'll probably do this one every 2 to 3 months, depending on how often they want this one removed.